Most seniors think the biggest risk with Medicare is picking the wrong plan. That's the wrong way to look at it. The biggest risk is waiting, because some mistakes don't show up for years, and by the time they do, you can't undo them. In this video, I'm going to walk you through 5 Medicare mistakes that you can't undo. Not opinions, these are rules written into the system. If you know them ahead of time, you avoid the penalty. If you don't, you pay, sometimes for the rest of your life. And to be clear, this isn't about scaring you. It's about making sure you understand the rules before you make a decision you can't take back. Mistake number 1, missing your initial enrollment window. Here's what most people don't understand. When you turn 65, you get a 7-month window to enroll in Medicare Part B. It starts 3 months before your birthday month, includes your birthday month, and ends 3 months after. 7 months. That sounds like plenty of time. But here's what happens if you miss it. The Part B late enrollment penalty is 10% of the premium for every full 12 months you were eligible but didn't sign up. And that penalty is permanent. Not for 1 year, not for 5 years, for as long as you have Medicare. Let me say that again. If you delay Part B for 2 years because you thought you didn't need it, you pay 20% more every month, every year for the rest of your enrollment. Now the smarter question is, who actually needs to delay Part B? And the answer is, some people do. If you're still working and have group health coverage from an employer with 20 or more employees, you may be able to delay Part B without penalty. But you need to verify that. You don't assume it. If this situation applies to you, you're still working, you have employer coverage, check with your benefits administrator before you decide. Don't guess, don't assume. The penalty for guessing wrong is permanent. Mistake number 2, assuming Medicare covers everything. A lot of people enroll in Medicare and assume they're covered the way they were under their employer plan. They're not. Original Medicare, that's Parts A and B, does not cover dental, vision, hearing, or long-term care. It doesn't cover prescription drugs. That's a separate plan, Part D. And it doesn't have an out-of-pocket cap. If you have a major medical event, your costs could be significant. Here's where people get surprised. They go to the dentist, they go to get hearing aids, they assume Medicare picks it up. It doesn't. And by the time they find out, they've already got the bill. The smarter question is, what does Original Medicare actually cover? And what do you need to add? Part A covers hospital stays. Part B covers doctor visits and outpatient care. Part D covers prescriptions. Dental, vision, and hearing, those are separate. Either through a Medicare Advantage plan that bundles them in, or through standalone policies. You need to know what's covered and what isn't before you need the care, not after. Before we get to mistake number 3, if anything we've covered so far applies to you, you can review your options and, if appropriate, complete your enrollment online at medicare-self-enroll.com right from home. No sales pitch, no pressure, just the information you need to make the right decision. Now mistake number 3. But here's what people miss. Medicare Advantage plans have networks. If your doctor isn't in the network, you may pay more or you may not be covered at all. And if you need to see a specialist, you may need a referral. Under Original Medicare with a Medigap plan, you can see any doctor who accepts Medicare. No networks, no referrals. Now within Medicare Advantage, there are 2 main types of plans you need to understand: HMOs and PPOs. They work very differently, and choosing the wrong one is a mistake people don't realize they've made until they try to use it. An HMO, Health Maintenance Organization, is the more restrictive option. You choose a primary care doctor, and that doctor is your gatekeeper. If you want to see a specialist, you need a referral from your primary care doctor first. No referral, no specialist visit. Or you pay the full cost yourself. And with an HMO, you're generally limited to doctors and hospitals within the plan's local network. If you go outside that network, except in a true emergency, you're not covered. A PPO, Preferred Provider Organization, gives you more flexibility. You can see specialists without a referral. You can go out of network, you'll pay more, but you're still covered. If you travel frequently or you live part of the year in another state, a PPO may work better for you because you're not locked into one local network. The smarter question is, which type fits your life? If you see the same doctors locally, you don't travel much, and you want the lowest possible premium, an HMO might be fine. If you travel, if you want the freedom to see a specialist without asking permission, or if you live in an area with limited network options, a PPO gives you that flexibility. You'll likely pay more for it, but you're paying for access. Here's where people get caught. They pick the plan with the lowest premium, which is usually the HMO, without realizing they're giving up the ability to see specialists on their own or get care when they're away from home. That's not a bargain. That's a restriction you're going to feel the first time you need a specialist, and your primary care doctor has to approve it first. Mistake number 4, not checking if you qualify for a Medicare savings program. This is the one that frustrates me the most, because the money is there, the programs exist, and most people who qualify never apply. Medicare savings programs, or MSPs, are state-administered programs that can pay your Part B premium and in some cases your cost sharing and deductibles. Depending on your income and your state, you could qualify even if you don't consider yourself low income. Here's the assumption people make. They think, I have some savings, I own my home, I can't possibly qualify. That's often wrong. Some states have higher income limits than people expect, and some programs look at income, not assets, meaning your savings account doesn't automatically disqualify you. The smarter question is, have you actually checked your state's income limits? Not assumed, not guessed, checked. If this situation applies to you, you're on a fixed income, premiums are a strain, look into your state's MSP. You can start at medicare-self-enroll.com and review the requirements without talking to a salesperson. Mistake number 5, waiting too long to get a Medigap plan. Here's something most people don't know about Medigap, also called Medicare Supplement Insurance. Your best chance to buy a Medigap plan is during your Medigap open enrollment period. That's a 6-month window that starts the month you're 65 and enrolled in Part B. During that window, you can buy any Medigap plan sold in your state, and the insurance company cannot deny you or charge you more because of health problems. They can't use your medical history. They can't ask about pre-existing conditions. After that window closes, it's a different story. In most states, if you try to buy Medigap later, the insurance company can look at your medical history. They can deny you. They can charge you more. They can exclude coverage for pre-existing conditions. I'll put it plainly. If you wait until your health changes to buy a Medigap plan, you may not be able to get one. And once you're on Medicare Advantage and want to switch back to original Medicare with a Medigap plan, that door may have already closed. The smarter question is, do you want the flexibility to see any doctor and the certainty that comes with Medigap? If the answer is yes, that 6-month window is your window. Don't let it close. So let's recap. 5 mistakes. Missing your enrollment window and paying a permanent penalty. Assuming Medicare covers things it doesn't. Choosing Medicare Advantage without understanding the restrictions. Not checking if you qualify for a Medicare savings program. And waiting too long to buy a Medigap plan. Every one of these mistakes has something in common. They're all avoidable if you know the rules before you act. That's the whole point. Not to scare you, to prepare you. If this situation applies to you, you're turning 65, you're already on Medicare, or you're helping a parent navigate their options. You can review your options and, if appropriate, complete your enrollment online at medicare-self-enroll.com, right from home. No pressure, no salesperson. Take the time to understand the rules, because the wrong answer is doing nothing when your plan is changing or disappearing.